Is that in your way? You can also move the table. I don't quite know.
Yeah, that's quite nice, isn't it?
Regional business. I will leave it. It seems safer than me pouring water over.
You committed to that?
Yeah.
Yeah.
Yeah, absolutely.
Fantastic. So I think we're ready to kick off, and sorry for starting a little bit late. So a very warm welcome to this IPPR event on great government in the 2020s. How will Labour fix our public services? For those of you who don't know me, I'm Karis Roberts. I'm the Executive Director here at IPPR. And I'm really excited for this event. And that's because public services and having a good plan for them is so critical at this precise moment. Firstly, because our public services are an absolute mess, I think it's fair to say. And on the in tray of any incoming government is going to be how to rapidly improve that situation. But also because there are a set of huge challenges coming down the track for our public services. So whether it's an aging population, constraints in public finances, how to use technology more effectively, etc. There are so many things that an incoming government is going to have to grapple with. And so I'm really excited for the discussion today. We have quite a few speakers, and so I'm going to make sure that we get to as many people as possible, and I will ask people to be brief. So just to introduce our speakers, we have Steve Reid, MP, Shadow Secretary of State for the Environment, Food and Rural Affairs. Pleasure to have you join us, Steve. I have Baroness Chapman. Sorry, I'm reading this on the order on my page, rather than the order on the stage, which is confusing. Shadow Minister for the Cabinet Office, so thank you for joining us, Jenny. Sonia Soda, Chief Leader Writer for The Observer, just over here. Nicholas Fox, who is Partner and Head of Government at KPMG in the UK, and also leading on Justice, just at the end on the left here. James Reid, CBE, who is Chairman of Reid in Partnership and Reid, on my right. And then finally, Harry Quilter-Pinner, who's Director of Research Engagement here at IPPR. So I will come to each of our speakers to make some opening remarks. We'll have a bit of discussion, and then I'm going to make sure there's some time to open it up to everybody here. So do please be thinking of your questions as we go. Harry, I'd like to start with you.
Thank you, and thanks all for joining us here today for what is an incredibly important conversation, and thanks in particular to KPMG and Reid who've made this work possible. I want to say, I think, 4 things. The first is about the inheritance that a Labour government will face if it is elected at the next election. And that is to say what we all know, and what Karis has already mentioned, which is that the state of public services are really, really dire, and the challenging inheritance that Labour will have to tackle. I think there's lots of comparisons here to 1997, where Labour won an election in part on the fact that the electorate had got fed up with public services failing them and had to rebuild. But I think in many ways the inheritance this time around, if Labour win, will be even harder. And that's because in many ways the performance, the state of performance is even worse after a decade of austerity, and also because the fiscal environment that Labour will inherit is much harsher. It will be much harder to turn on the taps, and we forget that although 1997 the New Labour were immensely reforming government, they also spent quite a lot of money fixing our public services, and we're going to have a much tougher time finding that cash in this environment. Although I still think, as I'll say in a second, we are going to have, whoever is in government will have to do that to some degree. The second point I want to make is, in thinking about reform, there's a binary conversation that's starting to form in the kind of public debate around this. On the one hand, you have people who think that a magic money tree is the answer, that if we just chuck money at our existing system, that is the fix. On the other side, we have a group who believe in the reform fairy. This is a term that The Economist came up with, which I think is very apt, that if we can just fix this system by reforming it. And the truth is that neither of those alone are going to tackle the scale of the problem. It is going to take more resource. But the question is, how do we channel that resource in a way that drives genuinely better, more innovative, more responsive public services? And I think that is the challenge that we've tried to answer in the work that we're doing. We published a paper today, which is how do we use the resource that we have, both the existing spending on public services, because we forget that actually we're already spending a huge amount that could be spent better, and also how can we find additional resource for those areas where we need to put more money in for public services to deliver. I think the big challenge, and one of the things that our work has highlighted, is that at the moment we've got a public service model rather than a public service model. New Labour introduced and built this public service reform system under this kind of auspice of new public management, a very techie term. And basically, leaders since have fallen back on this set of levers: top-down regulation, targets, incentives, choice and competition. And there are things there that we can use and salvage. There are tools there that are useful. But essentially, we are running out of road on how much we can basically push things from the centre, put more pressure on staff, harsher targets, harsher regulation will deliver better outcomes. And so looking forward, I think the big challenge for Labour is to take what we can from the lessons of the last 20, 30 years of public service reform. There are bits of that work, but also to, in the way that actually New Labour did, recreate a public service playbook that deals with the problems we have today. And in thinking about that, the work that we've done have set out what we call the 3 Ps of public service reform, the things that any incoming government will have to focus on and that public services should embody, and they are prevention, personalisation, and productivity. So a massive pivot to prevention, that's about the shift in resources that I'm talking about, and successive governments have talked about that but failed to deliver on it. So we really have to get to grips from day one and say we need to put more money into primary care and more money into community care, and that means holding or trying to hold down the growth in hospital spend in the NHS, for example. The same in criminal justice, where we spend too much on ineffective prisons and not enough on prevention and on rehabilitation, supporting people to rehabilitate in society. So that shift has to happen. Personalisation is really about the fact that too many of our services are impersonal. They don't treat individuals as individuals. They don't meet them where they're at. They don't empower them to make their own decisions about their lives. And there are amazing public services that are doing that, and I hope Steve in a minute might talk about some of his experience in creating those at the local level, but they are islands of innovation, and we need to work out how we spread them. And productivity, finally, is to say that we should be thinking about public services as an investment that give a return, that are about creating a healthy, thriving economy as well as healthy, thriving citizens. And that is a mindset shift in government that we need to make. This is not a drain on our resources. This is an investment in our future. And working out how we can tell that story and reform public services to deliver that is going to be really important. I will stop there because we've got a lot of people to speak, but I'm happy to come in later in more detail about our proposals for how to deliver that.
Fantastic. Thank you, Harry. Steve, I'd like to turn to you next for opening remarks.
Yeah, sure. I mean, first of all, I'd like to congratulate IPPR on the publication of the report and the work that Harry's led. It's a really helpful contribution to the debate about public services. And I know it's just one stage in a process, so hats off to you for doing that. You're quite right. The next Labour government, if we're elected next year, there will be no money because of the state of the economy, and it's going to take time to grow the economy. So we can't just be looking at the injection of additional financial resource. That's a problem, but it's not the only problem with public services. There's another problem in the way that we have run public services so far, in a very, very top-down way. So, and I'm thinking here not so much about the universal services like bin collection or street sweeping, where the running of them is fairly simple, although there's a significant cost to it. I think where the problem of top-down services is particularly profound is where you're working to provide services for people with more complex and challenging needs. So people living in social housing, people with mental ill health, people with social care needs, young people getting involved in forms of violence. That's where there is a high degree of frustration on the part of the service user that the service itself is not really meeting their needs. It's kind of stuck somewhere doing things that they've always done, but it doesn't quite seem to meet the needs that those people have. And that causes frustration, disaffection. There's a poor value for money and resource in that as well, because you're not directly targeting the problem as those people perceive it in their own life. So therefore your resource is going on something it shouldn't be. It could be targeting more effectively. So if the problem is overly centralized, overly top-down public services, how do you flip it? And what we did back in the day when I was leader of Lambeth Council, and I've been an MP for 11 years now, but I think the principles still apply, and there are many other councils doing aspects of this, is we used models of co-production to try to give power and a voice to people who are using public services, and then allow them to use that voice to shape the redesign and delivery of those same public services. And in doing that, they dramatically improved the performance of the public service in question. But it had an additional benefit in opening up the service to much more innovation and creativity than when we'd just been protecting a service as it had always been run. But it also strengthened people's confidence in the local state and in politics, because they felt the system had become much more responsive to them. So you could rebuild trust in politics fundamentally, even with people who had felt very alienated from politics. And at a time where we're seeing a collapse of trust in politics and therefore the rise of extremes of the left or of the right, finding ways to rebuild trust in politics is essential as well. So how does that co-production work? Well, essentially, we designed a commissioning system that allowed service users with appropriate support to identify, first of all, the outcome they wanted to achieve from the public service. And sometimes public services are trying to deliver things that people don't necessarily think is the right thing for them. So you let them design the outcome that they want to achieve. Secondly, the intervention that will help them to achieve that outcome. And thirdly, who the provider should be if the current provider is not meeting their needs appropriately and won't change to meet their needs appropriately. So it's a very, very different commissioning system. We called it cooperative commissioning because we were trying to do it cooperatively with the service user alongside the service provider. But it's a very different commissioning model. And I'll just give you a couple of areas where it made a big difference. Lambeth's Children's Services, when we were elected to run the council in 2006, we took over from a Lib Dem Tory coalition. Children's services were rated in the bottom 3% nationally. And this was after a legacy back from the 80s and 90s of almost industrial scale child abuse. That wasn't going on at that point, but the legacy was still very, very poorly failing public services. 5 years later, those same services were rated by Ofsted the best in the country, and they're still the only children's services to have ever been rated outstanding in every single category. And the insight that led that was not the insight of politicians or of managers alone. It was by allowing the kids in care, foster carers and parents to intimately inform the way that the services that supported them were redesigned. And all they did was they took the insight from their own lives and the challenges that they faced, and they talked about it with the service commissioners, and they reshaped the services in ways that much better met their needs. So you've got much better value for money, much better performing services, despite the fact that the funding for those services was going down. You know, it's quite remarkable to see that happening. And a second example I'll point to, and there were dozens right across the whole range of services, but social housing. I mean, any of you that are councillors or have been involved working with people living in social housing, they are very often very frustrated at the poor quality of management of their homes, repair services, dealing with nuisance neighbours, cleaning up the state of the estate if it's got dumped rubbish or it's got graffiti. We created a whole series of tenant management organisations supported by the council, but led by tenants and leaseholders who elected a board, and the managers of those estates became accountable to the board, not to the town hall. And that board, because it was accountable, it was made up of tenants and accountable to other tenants, directed the managers to do the things that the people living on the estate perceived as a problem. And it was over a 5 or 6 year period, an estate like the Blenheim Gardens estate in Brixton Hill went from being what people would openly talk about as a sink estate, and a place that people did not want to live, and if they did live there, they wanted to leave it. They turned it into a place that people wanted to move into and people living there wanted to stay in. And some of the difference they made was they managed to get their rent collection rates up to over 100% because they were able to collect arrears, working with people who had financial challenges and help to support them to better manage their finances. They, despite the fact that they were, like every other social housing service provider, having reductions in income, managed to generate a surplus so big that they were able to dig up a big concrete area in the middle of the estate called the Mall, where there was open drug dealing and prostitution, turned it into a green space with a children's play area, a growing space. They made the estate look absolutely fantastic. It got the neighbours knowing each other more, so you had a real boost in that relational aspect of public services as well. And people, instead of feeling that they were just done to in ways they didn't like, felt they had control over their own lives. And for people who are generally asset poor and do not have much experience of control over their own lives, it was transformational. So you can reform public services, deliver far better outcomes, and strengthen confidence in the local state and therefore the state, in my opinion, simply by adopting an approach where we as politicians accept we don't have all the answers and we have to win power in order to open power up appropriately to people living in communities so they could take decisions for themselves.
Fantastic. Thank you very much, Stephen. It's brilliant to hear those concrete and specific examples. Jenny, I'm going to turn to you next.
Thanks, Caris. And just to echo Steve's point about thank you to the IPPR, if you haven't had a chance to have a look at the report, I can very much recommend it. I found that it helped articulate some of the things that I've been feeling instinctively for a very long time about what isn't quite right in the way that we're delivering many of our public services in this country. And actually that's what IPPR often does quite well. It sort of gets at this little niggling thing and puts it in a report so that we can all discuss it as we are today. I've spent more hours than I think anyone can count talking to Steve Reed about empowerment and reform of public services. And it's an absolute thrill that there's some fellow travellers here today, hopefully having a really good time at Liverpool at the conference. Where I come at this is I like targets, I like clarity, I like a public service to know what it's got to do and what is expected of it. I recognise, explain why, but I recognise that that isn't all that is needed to make change and to give people the services that they quite rightly expect and actually need to live fulfilling lives and play their full part as citizens of our country. So the reason I'm quite so keen on targets is because of what I saw in the health service. So my dad died when he was 48 years old on a waiting list for heart treatment in 1994. Now, at that time, it was not uncommon for people to wait a year, 18 months for treatment. That was not unusual, and people were dying waiting for treatment. It wasn't unique to one part of the country. It was just seen as very sad, but something that happened. Alan Milburn came in, and completely changed the mindset, but he didn't do it by coming in a sort of Chris Grayling, I've had a great idea, this is what you're all going to do. He worked with the health service, with the trade unions in the health service, with the professions, with patients groups, and nobody was going to defend the system as it currently was. And there was a real desire for change and for clarity and for that mission to get those waiting times down and to save lives as a consequence. And I don't know anybody who works in the NHS who wouldn't want to be part of that kind of transformation. So having targets and having that sort of determination with resources often, but not always actually. Sometimes it is just by saying, right, this is the priority. This is where we're all going to put our efforts. It's a powerful thing. It gets results. And actually it's quite a rewarding thing to be part of because you see the impact of what you are doing. So I think that there is an important role for that approach, but I absolutely agree, and particularly in local government. You know, I was a lead member for children's services in local government, and I absolutely recognise what Steve has just described. And I think we need to celebrate and promote and highlight those examples far, far more than we do, because you do often see that innovation in local government, but who the hell's looking at local government, right? It's where things that are getting done on the ground against huge challenges, but we need to somehow find a way of putting those at the forefront of people's minds, because there's massive lessons that can be learned from local government, especially, I would say, in rehabilitation of offenders, and that power of partnership working and getting different providers together and saying, look, let's agree what the problem is we want to fix. I can bring this, my service can bring that. And let's have a government that actually supports that approach and doesn't get in the way of it. And I think it's one of the things I've seen over the last 13 years that's been the most saddening, actually, is the abolition of some, or the sort of the difficulties that have been faced by some of those locally working partnership organisations like crime and disorder reduction partnerships, which were really effective and were just starting to show results. And you don't see that approach so widespread anymore. Perhaps you do in cities, but you certainly don't in the majority of places. The other thing I think is quite interesting is this: we all know that we, as consumers of services, are used to now having a much more tailored, more personalised, more individualised approach. We've all got, information that's we can pick and choose. We've never had so much choice in our daily lives as we do now. And you often hear people say, therefore, public services needs to become more personalised, more tailored. We need to be able to give people much more choice. And I think that's right. But the other thing that's done, there's a dynamic there that is slightly different. So if I, as a parent, have a much more personalised, more individualistic sort of way of thinking how I want my child to be educated, what behaviours are appropriate, what I think is right, what does that do? This is a question. I don't know, I've only just sort of started thinking about this, but what does that do to the relationship between that parent and an education professional who might be trying to say to that parent, actually, you've got to bloody well get your kid to school, they've got to be clean and washed, and they've got to have a uniform on, and you've got to all these things that are important for that child's education. But is there a difference that started to grow, perhaps because of this, the way that we feel about our own ability to choose and our ability to want to shape our lives as we see fit? And I think that's something that we haven't really talked about quite so much, but I think it's sort of an interesting dynamic that is starting to emerge. The other thing, obviously, is about prevention. We spend far, far more on services in hospital in this country compared to preventative services than just about anywhere else that you could compare us to. And that has to change. And part of that is going to be about technology. Wes Streeting is buying lots of scanners should we win the next election. He wants to use those with AI to improve diagnostics, and that's fantastic. But the other thing we could do with technology in health is to make sure everybody knows that they've got that information, so they're able to make informed choices, so that they and their care provider know about their blood pressure, their blood sugar, their weight, their exercise. Loads of people are wearing trackers because they find that knowing how many steps they've done that day or whatever else they're choosing to track helps them make great choices. That should be available, and that should be something that's it's not just something you do yourself, but that is shared with your care provider, so you can actually help prevent and make really good decisions. And it's just the final point is this issue about, yes, we on the left do want to see properly resourced public services. Of course we do. And we recognise that we can only spend money that we have, and that in order to get that money to invest, we need to grow the economy. there is not a growth tap that you turn on day one of a Labour government, so this is going to take time. Equally, we know that there's no, as Harry says, reform fairy. You know, you don't just reform things and you're able to do as effective, efficient public services on day two because you've had some sort of initiative from the centre. It isn't going to be like that. So this is very much going to have to be a partnership between the government and, well, to my mind, initially, the workforce. And so the title really, you know, what that we're discussing, what's Labour going to do, you know, how will Labour fix public services in the 2020s? Well, we're not going to by ourselves. You know, that's not how we need to see this. We need to see this as something that we do together in collaboration, making changes that are the right ones, because as Steve says, they're the ones that actually make the difference, but also they're the ones that last. So I think that's the approach that we need to take.
Fantastic. Thank you, Jenny. Sonia, over to you.
Great, thank you. Well, thanks for having me. IPPR was my first proper job after university, so it's great to be back speaking at an IPPR event. I suppose I'm probably going to follow on. Oh, it sounds like I'm popping a bit on my mic. Does it sound all right? Okay, good. Excellent. So I guess I'm going to follow Harry in sounding, I suppose, a bit of a note of doom, because from where I'm sitting, the challenges, the existential challenges that face our public services have got worse since 2010. They're the same, but things have got worse. And I think it's going to take a long time for a Labour government to fix some of the things that have happened over the last 13 years. So where I'm sitting, kind of the big question marks that we face as a society that relate to our public services. I mean, other speakers have kind of touched on them, but they're all very familiar themes, so I'll run through them very quickly. But on the NHS, I do think we've got a real issue around patient safety. If you read reports from mid-staffs, the maternity scandals, some of the features actually around, you know, Lucy Letby's awful crimes in terms of how concerns were flagged. The themes are common, so it's not an issue right across the NHS by any means. You can get excellent care in the NHS, but where it's bad, it's really, really bad, and patients don't have a voice. So that's always been an issue with the NHS. And mid-staff was really kind of the first scandal to kind of really become very public, but I don't think much has changed where things are bad, actually. We've also got, you know, obviously we need to make the NHS more of a service about prevention. We need to think about social care. With social care, we haven't answered any of the funding questions that were being asked in 2010. But actually, for me, the questions are much bigger than funding. Yes, there is a question about how we pay for older care in an ageing society in a way that enables people to live dignified lives. That are flourishing, as opposed to, you know, basically just thinking about social care as a system of managed decline until the end, which is how we think about it at the moment. But, you know, those questions are far more profound than funding. It's about what kind of society do we want to grow old in? What is the relative role of the community, the family and the state? We haven't answered any of those questions. Do we all want to live in a care home for the last 2 or 3 years? I know I don't. Yet we're not really able to have a conversation about that. So they're really, really profound questions around ageing, which aren't just about policy wonky questions like integration and then, you know, big questions like how we fund. It actually goes to the heart of what kind of society do we want to be to grow old in. On education, there's a huge range of challenges. We've still got the long tail of underachievement that we had in 2010. Too many young people leave our education system without functional numeracy and literacy, the skills they really need to get on in life. And because of our one-shot education system, the way it's structured, it's like you either get those skills at school and then possibly go to university. It's still very, very hard. We've got a terrible system of lifelong learning. So that absolutely needs reform. We've still got an attainment gap, which is related to that long tail of underachievement. I think we've got big existential questions to ask about the higher education system as well, which aren't just about funding. And there's a lot of there's a lot of polarization in the debate where some people talk about, you know, Mickey Mouse degrees, a very insulting phrase, and other people are like, oh no, the university system's just great. Well, I'm somebody actually who thinks that there's real questions to be asked about our university system and the value that gets added, you know, in terms of young people and their skills and how it helps them get on in the world. And we are actually, because we have no way of measuring what universities are adding, and universities just say, well, it's all good. Actually, we've got no idea which universities are working really well for young people and which aren't. And it's a hugely important question, because young people are paying an extra 9 percentage points on their income tax, most of them, for most of their lives. And that's kind of a really terrible deal if most of what you're getting from a university degree is signalling. And, you know, a certificate that says that you've done university rather than really useful skills that you're going to be able to apply in the workplace that you know are different, that you could have got from going and actually working in the workplace for 3 years. So, you know, I'm not disparaging the whole university sector, but really serious questions where we don't even measure the value added in the way we do schools. We've got no idea how to do it. Actually, we've got a university sector which, in my view, you know, it's really funny. When I started working on HE, I was really shocked, because you go to a round table of head teachers and you know, they'll be saying, well, what can we do better? And when you go to a round table of people from the HE sector and they're like, we're the most amazing sector in the world, I might get very defensive when you suggest that there may be kind of questions to be asked. So I think we've got big questions around that. Childcare obviously needs massive reform. In my view, we need a free system of universal childcare. It's absolutely crazy that parents have to fork out thousands to put a child, you know, age 3 in full-time childcare, which is educational, whereas when you're 5, obviously, school is free. I think Bridget Phillipson's been really good, actually, on wraparound care as well. Breakfast clubs are a no-brainer, but really big questions there. And then vulnerable children, which is you know, an area of massive interest for me. Children's services have been absolutely decimated in this country, and that obviously feeds into things like the attainment gap, the well-being gap as well. And yes, it's got, you know, and I used to work for a charity called the Dartington Social Research Unit, and our remit was helping organisations use evidence to improve children's lives. Absolutely, it's got to be about prevention. But the thing about prevention is people often say, well, if you spend more on prevention, you need to spend less on acute services. That's just not true, because the level of acute services that we've got, you know, there's evidence that suggests it reaches a fraction of the number of young children and young people with need. So even if you get preventative services that work, there will be more children and young people who come forward who need those acute services. So you need a really honest conversation about that. You have to fund prevention, and you're always going to have to fund those acute services. So I guess that takes me nicely onto sort of, I guess, my end concluding thoughts, which is, I think the reason why it's so difficult is I've never been somebody who thinks that, you know, money is it when it comes to public service reform, because if you look at the NHS, mid-staffs happened at a time when the NHS was incredibly well funded. But you can't do reform, you can't do some of these big things without resources. And as everyone's already said, we've got public services that are seriously under-resourced. If you look at the NHS, we do not spend enough money on healthcare. As a society. We don't spend as much as our competitors. We don't have as many hospitals, nurses and doctors per head as you know, some leading competitor countries of ours in Europe, and that really shows. And so, you know, we have to be honest with ourselves. If we want a society where we age well, we've got to be spending more on the NHS and social care, and that should be going up as a proportion over, you know, of GDP over time. And we've not been doing that. So resources are really important, and that's true right across the piece. But also staffing. There's massive, massive staffing issues across public services. You know, in education, like we've got a teacher retention and recruitment crisis. When I was a governor of a primary school, we became an academy, and then we lost our really amazing head who took us from basically a failing school to outstanding. She'd completely transformed the school, but it was a real lesson to me in how brittle things can be, because once you lose your transformational, inspirational head who's working 90-hour weeks, you shouldn't be working 90-hour weeks, but she does it for the kids. And actually, as governors, you know your head shouldn't be working that hard, but also, you know, what other kind of choices there in some ways. But, you know, when they leave, and then her middle leadership team and her senior leadership team leave, we were an academy at that point. We, as governors, were legally responsible for that school. As lay governors, we were directors of you know, very small primary academy trust. We did it because we knew we were going to be forced to academise, so we wanted to get ahead. We put out an advert for a head teacher. We did not get a single interviewable candidate. We had about 3 applications. And then what do you do? In the end, we managed to join another academy trust, but that was like 8 years ago. And the crisis in education and schools has got worse. It's really bad in the NHS. So these are really significant issues, and resourcing is so important. And, you know, I totally understand where Labour is coming from politically, in terms of treading a very cautious line and making the line about growth, and we need to grow, and then there will be more money to spend, and that is basically what happened in 1997. But the problem is, and I think this is a big existential question for Labour, can you grow without some of these things? Because for me, public services are foundational, and actually it's really hard for an economy to grow when you've got people who are long-term sick because, you know, they can't get treatment and they've been waiting for over a year for an operation, or because, you know, you've dropped out of school and, you know, there's no way back. So I think the politics are really tricky, and, you know, I think it's very difficult for Labour strategists. But for me, there's a real question. If you're saying that more spending is dependent on growth, can you get the growth without some more upfront spending? I think that is a really difficult chicken and egg question for Labour.
Thank you very much, Sonia, and thanks for that challenging question. I'm going to move now to Nicholas.
Thank you, Karis. So I think we all agree that expectations are rising, waiting lists are getting longer, there's a shortage of staff, and all of that against the backdrop of those backlogs that are left over from the pandemic. IPPR's research that has just been published poses some really interesting points for debate. I'm actually particularly taken about the mission-led themes. How do we join up across government and work around particular themes almost against the structures, making the structures work in a different way? And maybe that's something we'll come to in a minute in our debate. But I wanted to go back to where your research starts, which is the balance between investment and reform and how we do that, and particularly who the we might be. Because what if I told you that I had an idea about how we could remove some of the morale-sapping backlogs and provide a less risky way to transform for the long term? That's the idea I want to test here today. The services I'm talking about are the less glamorous public services. So I'm not about to pitch to you that I take a list of people who need new needs and sort that problem out. No, I'm talking about some of our vital public services that perhaps attract a little less attention. Things like lasting powers of attorney, or subject access requests, or even actually migration casework. These are all examples of backlogged public services where at the heart we have a casework function that's no longer fit for purpose, that's been overwhelmed with demand, and is working in an environment that actually does matter. Imagine you have a loved one, a family member who's experiencing cognitive decline. You need to get a lasting power of attorney so that you can make decisions about how to handle their care in the future, or their finances at the point that they're no longer able to do that. I don't know if anyone's had to do that. I don't know if you know how long it takes. You have to fill in an unfamiliar form. You've got to get wet signatures, probably from people who don't necessarily live close by. You've got to gather unfamiliar documents, put it all together, and then submit yourself to a queue, which can take several months. Now imagine if you're a public servant working in that system. Through no fault of your own, lack of modernisation in your job, you are working in a morale-sapping environment, knowing full well that you can't meet customer demand, that you're letting people down, that you're not able to process in a reasonable time. Imagine how completely demoralising that must be. So who's the we, and what's my idea? Well, it's how the private sector can help. Just imagine if you pass over to the private sector the backlog. Literally take the backlog away, take it off your books, get rid of it. If it's big enough, if the backlog's big enough, then maybe you'll have a competition and chunk it up and pass it off to several different providers. What that means is you're left with public servants who can focus on delivering today's service to today's people who are requiring service without the drag of that backlog on them, and that gives them an instant boost. Commercially, you would pay the private sector a fixed amount for each case processed. You'll get back a completed case file, all the evidence fully audited, something that then a public servant can make the final determination on based on the information in that file. But where's the transformation, I hear you ask me? Well, because your new backlog-busting partner is incentivized to deliver to a fixed price, they'll want to maximize efficiency and they'll want to minimize costs. So that's where the commercial upside sits for them, and they'll therefore look for ways in which they can streamline the process. They'll deploy new technology and they'll innovate. The costs and the risks of doing that sits with the private sector. It doesn't sit with the public sector. But the benefits, once they've been proved, could flow back to the retained public service. And what's the alternative? Well, traditionally what we do is hire more people or borrow them from the contracting market. More people mean we can process more work, so the backlog is cleared, but the costs rise, and it's not investment, it's just spending more money. So to fix the it's not transformed. So to fix the transformation point, what would you normally do? Well, you might commission a transformation program. You might talk to people like me, actually, come up with a plan, cross your fingers that your plan doesn't get cut, cross your fingers again that actually it delivers on time and to budget and against your original specification. And after all, that's bound to happen. So I think public services need reform. I think we need to build on that idea of partnership and empowering people. And I think that there's a way in which the private sector can support without adding cost or risk to the public service.
Fantastic. Thank you, Nicholas. And then finally over to James.
Thank you, Karen. Good morning, everyone. It's very interesting to hear all of these ideas and takes me back to when we started Read in Partnership, which was 25 years ago in Hackney in London. And we were appointed by the then new Labour government to help 18 to 24-year-olds back into work. And it was the first time the private sector had actually been invited to do that kind of work. So this was sort of pioneering and new. And we learned so much as we went along. And one of the things that I remember at the time is that there was sort of a category of people who were written off. You know, people said that they'll never get a job, they're unemployable. And we decided that there was a job for everyone and we were going to go out there and do our best. And I really remember I was invited on the Today programme. There was a sort of very tough interviewer called John Humphreys, who older people might remember. And he said, you know, it's a waste of time what you're doing, isn't it? It's a waste of time because there aren't any jobs in Hackney. And I remember saying to him, all we're asking is for local employers to give someone a chance, just like someone gave you a chance, John, when you started out in your career, and that's all we're asking. And you know what, within 2 weeks, we had 1,000 vacancies in Hackney. And we were getting jobs for people who thought they would never get a job. And that's how our company really began. And since then, we've placed over 250,000 people who've been long-term unemployed into work. And I've learned so much along the way about how every single person is different, how every single person has different issues and different causes for their situation, and how our service must be tailored and personalized to every person as an individual. So we've seen at Reed, we've placed people who've been out of work, unemployed for 25 years into jobs, and it's incredibly transformational and moving when that happens. We've seen people who've come out of prison, 20 years in jail, and we've placed them into work. And just recently, we placed people who'd come from Afghanistan, who'd worked for the BBC in Afghanistan, were flown out hurriedly a couple of years ago, and we got a number of them into jobs. So there is a job, I believe, for everyone, and we've developed our services from those early origins and widened them into what I would call people-centric public services. So now we do things as diverse as the driving theory test. I don't know if anyone's had the good fortune to go into one of our centres recently, but there was a huge backlog after the pandemic. We've done over 4 million driving theory tests. But we're also doing preventative work, helping people who have health issues, with smoking cessation and weight management. So we're doing what I would call people-centric services. And the key thing or focus for us is people. I mean, you mentioned the 3 Ps, but the sort of top P for me is people. And it's the people who come in and meet us. And I was very struck what Steve was saying about how he was organising with the cooperative approach, because that really resonated with me, because we look for a service that's continuously improving, and it's a Japanese business philosophy of Kaizen. But you basically invite everyone to suggest, how can we do a better job for you here? And your service users, our service users, can contribute. And we've had 83,000 people over the last couple of years give us feedback on what we call participant voice, which is a software system, and they're rating it at 4.7 out of 5, which is really encouraging. But it's really the service, if we can improve it at all, has to involve the users in a continuous dialogue and process of improvement, whether, whoever's providing it, I think. And that's a key service business principle. And I think looking forwards, I know in the Labour Party there's a big debate about how much should be done centrally and how much should be done locally. I would say the service recipient doesn't necessarily know or care who's commissioned the service, but as long as there's that ability to provide feedback and dialogue, can continuously improve. So I think a culture of continuous improvement is really, really important here. I'm not as pessimistic as you. I think we had an idea just after that. I think we can really improve the services for everybody, and I think we should leave here with that determinedly in mind. Just a little last word on Reed, just to support a comment that was made earlier. It's a family company, Reed. It was founded by my dad in Hounslow in 1960, and he had an investment of £75 to start the company, and we've grown it since then. Our business strategy is to grow organically. So we don't make acquisitions or anything. You can only grow organically two ways: by giving a good service and having good ideas or innovating, which is what we're talking about here, actually, giving good service and innovating. And anyway, our last accounts, I asked a question on the way here. How much tax did we collect last year through PAYE, national insurance, VAT, and corporation tax? Well, that £75 investment in 1960 just returned £250 million to the Exchequer last year. So when we're talking about growth and the economy growing to support public services, that is, as Rachel Reeves rightly said, fundamental to this. So if we can create more businesses that are growing like that, I mean, we're just a small company, a family company, but if that was happening right across the economy, that would solve a lot of these problems, because we're looking for ideas and we're looking for money. And I think that combination is desperately needed.
Fantastic. Thank you, James. So we're going to come to questions in a second. We're quite a big panel, so I'll direct questions to each of you rather than everyone answering everything. Just before I go to the audience, though, I did have one question, because I think it's quite an important point that's come up in the comments and also we've been grappling with in our research, which is this central-local point. Because a kind of centralist approach is often seen as providing accountability and making sure that you reach minimum standards across the board, whereas localism can really support experimentation and innovation. And I wanted to ask, perhaps starting with you, Steve, kind of, is there a tension there? How can you encourage that experimentation while providing accountability? And why don't we have more of that experimenting?
Yeah, there's a definite tension there. But it's not just between national and local, because in the same way that you can get centralisation from the centre of government in Westminster, you can get local centralisers as well. So where you've got a council that wants to take all of its decisions for itself and not involve residents, the town hall can feel as remote as Whitehall. So you need local government or local service providers to be operating in the way that we've talked about, whether you call it continuous improvement, involving consumers, citizen-led, cooperative public services, whatever the language. Models of co-production open up decision-making to the people that are using the public services, and that is a challenge at local government level as well as a national government level. And I actually see a different fracture in politics to the normal left-right one here. There are centralisers and localisers, and it doesn't just fit your normal left-right split. There are some people in the Tory party that get the localisation agenda, and some people in the Labour Party that resolutely don't. So there is a very different split there. For my money, and this is just my opinion, it's not my brief local government, my opinion is that you need a different relationship between national and local government, where instead of national government treating local government as its agent, it sets outcomes that it expects to be achieved, and it's entitled to do that. It's the elected national government. But local tiers of government would be free to choose how they were going to achieve those outcomes, and they could also set their own priorities and work towards those as well. Then what you would have is a model of sharing best practice across the sector, so that people could see what had worked in one context and then adapt it to their own context. And that creates effectively a learning environment where the sector is learning from best practice, how you improve things, and it requires politicians to not see good practice and then look at how do you scale it up to turn it into a universal service, because that scaling up loses the very local nature of it that helped it to succeed. We need to go from scaling things up to how do you appropriately replicate them so that they can work in different contexts. It's a very different way of relating between national and local government, but it requires change at both tiers, not just national.
Thank you. Harry, do you want to say anything about how our researchers are thinking about this?
Yeah, I think I mean, I agree with Steve, and I think the other thing that I would add is I think we need to be thinking about devolution within public services as well. So at the moment, the devolution conversation is about national to local government, and that's certainly important, and IPPR has championed that via IPPR North for decades now. But we talk much less about what happens within the NHS or within schools, and that's both about giving organisations more autonomy from the centre, but also frontline staff as well within those organisations. So again, often you might, academisation, for example, to some degree gave some autonomy to schools, although a lot of that was reversed by leaning very heavily on Ofsted as a regulator. But then the teachers themselves don't feel any benefit from that necessarily, unless the school is run in a different way. So I think there's also how do you free up frontline staff to innovate, to respond to the person in front of them rather than the diktat from up above. I think the other thing we need to think about is often we talk about passing powers down. We don't, and that being something that needs to happen locally, like something needs to change locally as a result of that. Actually, it's Westminster that needs to do quite a lot of the changing in order for that devolution to actually make the change that we want it to. And two things that I wanted to flag. One is on this debate about targets that you were mentioning. I think the research that we've done absolutely shows that there needs to be guiding stars in the systems in order to make sure that we focus on what matters, in order to have some element of accountability, prioritization. I think the challenge that we've identified is that you, at the moment, might have 60, 70 targets in a service. So the ICSs, for example, have 80 different metrics they're being held accountable on. If I ask you to do 80 different things right now, you can't do it because you're pointing in every different direction at once. So I think the missions actually give us a really good starting point to say, let's pick a few guiding stars, outcomes, not inputs, because outcomes are what really matter, and then let's free up the front line to deliver on that. And finally, to say, it's not that there's no role for regulators, regulation, and holding public services to account should happen, but we've lent far too much on the stick, and we've not done enough on supporting local providers to improve. So as James was saying, I think we should be putting a lot more focus on the helping systems to improve. So whether that's through learning, the evidence infrastructure that works in some sectors, education's got EEF really, really strong, others don't have that. Leadership, it's often the leaders of organisations that actually do the real change, and I don't think we put nearly enough emphasis on supporting leaders to grow and thrive. Or data, again, there's huge opportunities here, but those, to me, looking forward, are the levers that would really drive improvement. I don't think regulators coming down harder and harder on frontline staff without the support is going to get us to where we want to get to.
Thanks, Harry. So I would like to take some questions. I can see one at the back there, and I'm going to take 3 at a time.
Hiya, my name's Mary Brooks and I'm a councillor on Cheshire East Council. I'd like to hear a little bit more about what Labour should do about the massive SEND deficits that local authorities are dealing with. In Cheshire East, we've got close on a £50 million deficit, which is held in a negative reserve, paying interest on that, and it's absolutely crippling us. It's an absolute emergency that needs to be addressed. It's been driven by the mantra of choice because we're a relevant affluent borough, and this deficit is actually inversely proportioned to deprivation. So we're not actually expecting any more money from Labour because we are an affluent borough, but this is actually going to kind of cripple lots of local authorities. You know, we may be following Birmingham if like Labour doesn't kind of give a grip on that, because it definitely needs reform. Thanks.
Thank you. And I think there are 2 there, so we'll start on this side of the room.
Hi, my name's Fabian. I'm from Devo and Flect, which is a public affairs company. I have a really boring question about digital transformation. The Aintree and the New Royal in Liverpool, for example, they have different prescribing systems across the different hospitals. They also have computer systems that take 20, 30 minutes to turn on and use Microsoft Office 2001. Yeah. It sounds really boring, but this is the kind of stuff that takes up enormous amounts of administrative time. And I was just wondering what Labour might do to try and deal with some of those digital transformation systems and getting the systems to talk to each other, because that's the other problem with that. You have that across the police as well. This is a cross-public services issue, not just an NHS one.
And hi, I'm Sophie Metcalf from the Institute for Government. And I was just wondering if we could speak more about how we can usefully join up public services as well. It feels like a lot of the issues and the rising demand and particularly challenging complex cases we're seeing across public services are very intersectional. We've got issues across housing, across healthcare, across justice, and similarly to a previous question about kind of digital join up, but more kind of structurally as well. Are there kind of some structural issues underpinning these, and are there useful ways that we can there can be better cross-government working to help solve this?
Great, thank you. So we had a couple of questions there kind of specifically for Labour, particularly on deficits and digital transformation. Jenny, I wondered if you wanted to pick either of those up.
Yeah, I mean, first of all, great short questions. I don't think I've been to a fringe yet where the questions have been quite so succinct, so you get recognition for that. I think the points on the digital transformation and these legacy systems and not speaking to one another goes quite well with the question from, sorry, I didn't catch your name, but the Institute for Local Government about how to join up services. Is there a way of using the things that Harry hates, regulators and enforcers, to actually encourage that kind of behaviour from public service providers? Because at the moment, there's so many incentives, if you're a hospital trust or an academy in a locality, to actually not really engage with other organisations or other providers where you are. And is there a way where we could ask Ofsted or the various different regulators that engage with local government to ask the question, tell us about what you're doing, to work with your local health service providers, with your local third sector on services for children, and show us how you're designing those systems and how, is there a way of doing that? I think that's something that I'm quite interested in understanding, how we use the levers that the people at the centre do have, and actually in health and education, there's a hell of a lot of them now, compared to probably what there was when Labour was last in charge, because of the way the Tories have gone about, completely atomising everything, to reinvigorate some of those local partnerships. And I think that's part of, but obviously not the whole solution.
Thanks, Jenny. Nicholas, I wonder if you want to pick up the digital transformation point.
There isn't really an easy answer. I think organisations, private or public, need to tackle their legacy technology debt. You talk about frustration and admin time, but there's also the security issues of running services that are out of support. And so it's something that needs focus. It will need, unfortunately, investment. I guess the good news is that with the advances in technology and how we manage data, we don't need to look at these huge corporate enterprise-wide bespoke technology systems of 20 years ago that would run over budget and would go wrong. There's lots and lots of solutions available, the way you can put together things and work within your technology estate. But it is important to get off these legacy platforms.
And just to kind of re-emphasise that, I always find it extraordinary when there's so much talk of, the cutting-edge technology, when actually we're so far behind on basic technology across so many public services. I think it's a really important point. Harry, I think you wanted to pick up the join-up of public services.
Yeah, I think there's kind of two bits to this. There's join up at the local level, where I think devolution offers the best opportunity. It doesn't always lead to better join up, but it often can and should, because you're just managing these services on a much more kind of manageable footprint rather than at a national level. It's kind of just a massive task. But I think we will only get that right if we can rewire the centre, and I think the missions offer an opportunity to do that. We looked at and thought about the idea of restructuring Whitehall around the missions as an option, and obviously Scotland has gone some way towards doing that, so departments based around missions rather than departmental silos. The truth is the evidence, and IFG know this better than anyone, of restructures are just that they don't pay off. Even if there might be something that in an ideal world makes a bit more sense, the transition cost completely outweighs any benefits. I think what we have set out in the report actually that came out today and was covered in the Times is there are things that you can do to tweak the wiring of Whitehall to actually help this, and I'll give 2 examples. One is looking at a different model of cabinet office is very appropriate to you, which is to say, could we create mission councils? They don't sound very exciting, but if you think of something like the National Security Council, a decision-making body that gets all of the key ministers and civil servants around a table to make decisions, and with the Prime Minister in the room, that does drive behaviour change in Whitehall. We saw it again with Tony Blair and the delivery infrastructure in 1997. That is how you, if there's a clear directive, if decisions are made jointly, if there's shared plans across Whitehall, that can make a difference and filter down. And there are models there that can work. And so I think looking at how you restructure the centre to drive through the missions is going to be really important. The second is also how you use spending to drive joint working. There's something, again, we're getting into the weeds of techiness here, but obviously great for IFD. There's something called the Shared Outcomes Fund in government where it's essentially looking at making spending review decisions jointly across departments. I think it'd be really powerful for Rachel Reeves to stand up on day one and say, if departments come to me with a joint spending plan on these issues that show that we can spend money better jointly, you are more likely that I'm going to sign this off. There's a benefit to you putting money through this mechanism. I think that would have a very powerful effect on the way in which Whitehall works. And you can imagine already some of the areas where that would create great benefit. Think about young people's mental health. Wouldn't it be great to see Department for Education, Department for Health, as a bare minimum, maybe even DCMS technology, is that right? Acronyms. If we could get joint plans on how we're going to tackle youth mental health, that would be a massive step forward. So I think, sorry, a bit techie, but you are an IPPR fringe, so I assume that's what you're here for.
Fantastic, thank you. Steve?
Yeah, just briefly. Missions are absolutely the right way to look at a reform of government decision-making, because you're taking decisions out of just one department or one perspective and looking at it across the piece. And Sue Gray, the new Chief of Staff in the Leader's Office of the Labour Party, will be looking at how we can reconstruct around the missions, but I don't know. She won't have come to a view yet, so I certainly won't know what that is, but I think it's the right way to go. I've got some insight from my time in local government, though. We spent a decade wondering how you could get better cross-silo working. And after all that time, realised that the best way to stop the silo barriers getting in the way was to abolish the silos. And it seemed blindingly obvious to me, because for some reason we structure government and local government as if it was a financial institution. It's very risk-averse, it's very controlling, it's very top-down. You have tiers of managers, directors, all the way up and down the organisation. But communities are very sort of dynamic. They're very vibrant. They change. Their needs change all of the time. And it struck me, my background is actually working in publishing, and in the creative sector, you don't have those very big vertical organisations. They're flatter. And the reasons they're flatter is that flatter organisations are more creative. So we restructured the council that I was running to get rid of tiers of management, flatten it, use that co-production model, the cooperative commissioning model, to support communities of interest, we called them, but that was really groups of people with a shared need that needed to be met by public services, and supported them to define the outcome, the intervention, and the provider that would best suit their needs. So you could flatten the organisation, speed up decision-making, make it much more directly responsive to citizens, increase the level of innovation and creativity, and get better outcomes for less money. But the way that we got rid of the problem of siloed thinking was we got rid of the silos. I'm not saying that's what we're going to do in national government before anyone wants to report that, but that was an approach we took in local government.
Fantastic. I want to take a couple more questions, if I can see some hands. So I think there's one over here in the middle. This lady in the middle, Ali.
Thank you. Sorry. Susan Hawley from Spotlight on Corruption. I wanted to put a question to all the panel, which was to pick up your point, Harry, about how do we win this invest to save argument, or as Sonia put it, spend to grow, with the public, with the markets, because I don't see how we're going to get around this problem unless we win that argument, because the retention problem you mentioned, Sonia, is across the board. We can't even find judges who want to be judges in the courts.
Fantastic, thank you. And there's another one at the back.
Matthew Horn from Innovation Unit. I thought I heard a bit of a defence of targets in public services, and we know that targets work quite well for complicated problems, which provide a focus for a single organisation where there's a relatively low need for collaboration. But most of the challenges we face are not like that. They're highly complex. They require multiple organisations. They require high levels of collaboration. So challenges that we face in public services, such as domestic violence, mental distress, drug and alcohol problems, poverty, they're not easily amenable to simple target approaches. I think we saw more rapid transformation in public services during COVID than I've seen in the last 15 years. I think we should ask ourselves, why was it that during COVID more change happened more rapidly, when in effect some of the governance, regulation and target-driven culture was paused?
Fantastic, thank you. Sonia, you were talking about winning the investor save argument. How is that done?
Yeah, well, actually, I think I really do think you need to have an honest conversation with the public, actually, about how much this costs and how much an ageing society costs, for example. And I think it's really striking. I mean, obviously, we're living in different economic times. It's hard to ask people to contribute more when there's a cost of living crisis. But I think it's very striking that when Gordon Brown introduced a penny on national insurance for the NHS, it was like literally one of the most popular tax rises ever. Like, I can't remember the exact figure, but it was supported by over 90% of the public, which I think shows that there is space. And I understand why Labour don't want to do it going into an election, but there is absolutely space for political bravery in making the case for contributing more, and particularly if you contribute more fairly, to pay for better public services. And I think particularly when it comes to the NHS, but also other things, you can do it if it's tied to specific public services, and people, even if it's not formally hypothecated, sort of have a sense of where the money's going. And I really do think that it's very instructive that a penny on national insurance for the NHS was so popular.
Thank you. And James, you've dealt with some pretty complex issues through the services that you offer. What do you think about this question of the role of targets and how we achieve rapid change in very complex areas?
Well, I was thinking about that when it was mentioned earlier, and I think in business, targets can be pretty helpful, because if you want to give a lot of autonomy to people, if you have a common purpose and an objective, and we want to sort of achieve that, then everyone's working towards that purpose, they can get on with things. But where there's huge complexity, I have some sympathy that might not work very well. So I think I'm always trying to simplify things. I think if you can, clearly there are huge complex problems, but the more we can simplify them or break them down, I think the better. And years ago, I was an associate of the Prime Minister's Delivery Unit, Tony Blair's, which was run by Professor Michael Barber. And I thought it was an amazing initiative, because they effectively invited help from people who could volunteer as associates. And they had people from all over business and other walks of life who were really actively putting in ideas. And I think they achieved a lot, actually. And I contrast that because, I don't know whether I should say this, but in 2009, after the financial crisis, we created a campaign called Keep Britain Working. And we got thousands of ideas for the next government, because we knew there was an election in 2010. And we gave a book with all these ideas in to the new Prime Minister. That was the pledge, and it was obviously David Cameron. And I presented it, and then 6 months later it was on eBay. so I just think it's a shame that the ideas that could have been sort of absorbed or thought about or considered weren't. And I think trying to create a culture and a space for the injection of ideas and asking for help, and this is a collective effort. It's a whole community, a whole society that wants this to improve. It's not just the people who work in the public sector. It should be everyone who contributes in some way or another, both financially, I agree, but also with ideas and suggestions.
Great. We have about 10 minutes left, and I want to give all of our panelists a chance to give some closing remarks. Perhaps either if there's something that's really come out of this conversation for you that you want to address, or otherwise a key takeaway that you want our audience to leave with about what we need to do in public services. Having gone inside out, I'm going to go outside in, so I'll start with you, Nicholas.
Well, I think we've had a good conversation about whether to invest or not. Public services are not going to reform without investment. I think we need to face up to that and think laterally about how we attract that in and where we find the money from. I really believe in focusing on outcomes within a framework. Maybe that's a fudge around targets, but I think if we really focus on what we're trying to achieve and be clear with that, then we can think again innovatively about where we get the support from and drive improvement that way. And then finally, I think we should be really consistent in how we do that. So it comes back to Harry and the missions, actually. If we can align with clarity from government around what really matters, regardless of who's responsible for delivering it, what actually matters in public service, and drive a line through that within an outcome-based framework, then I think we don't need structural reform. I don't think we need to worry about machinery of government, or whether it's local or central, or whether it's devolved, or whether it's private sector or public sector. I think with that clarity of mission and strong, consistent leadership over a longer term, we should be able to see quite dramatic improvement in public services.
It's a hopeful note to end on. Thank you. James?
Well, I think it's important to ensure that public services are designed to be flexible and responsive to the needs of individuals, and the whole culture of the development and delivery has that at its forefront. And I think that actually is more relevant to the positive outcomes than where the service is commissioned. I think it can work in a number of ways. I think this is a long job, though. I mean, this isn't going to happen overnight. So if Labour want to really improve public services, you've got to win 2 elections, because this is going to take time. I think too often people think things can be fixed quickly. And I think something I've always thought in business, asking for help is a great thing to do. And there'll be people out there who've got huge capacity to help. So ask for it. Why not?
Fantastic. Thank you. Jenny?
I mean, I think this is the start of a conversation, which is like a really naff thing you're going to hear a lot of at party conference. But it's a serious point about this isn't something, you don't get a new government, it comes in, does reform, job done, you move on. This ought to be a permanent state of reflection and innovation and desire to change and improve that runs throughout our public services. And at the moment, I don't think that's the case. I think people are absolutely knackered and frustrated, and there is nothing worse than working. I mean, I've worked in prisons for a while. There is nothing worse than working in the public sector and feeling that you are not able to deliver what you know you could if you had, some of it's resources, but some of it is just about flexibility or the ability to do what you need to be able to do. And I think this has to be a sort of a permanent state. The reason why missions are so important to the Labour Party at the moment is because they do help to cut through silos, but they also give the why to some of the things that we're going to have to be doing. And again, experience on the front line is if you understand why you're being asked to do something, why that target, or whatever the phrase you use that isn't target, is being asked of you, that makes such a difference. In '97, we introduced the Numeracy and Literacy Hour in primary schools. That was not received to universal acclaim by every primary school teacher or trade union at the time, but pretty quickly, teachers got into this. And they thought, you know what, I'm seeing results here. I like this. Yes, I'm forfeiting a little bit of my autonomy and creativity as a professional, but look what I'm gaining. I can see this is benefiting those kids. And that, I think, that has an enormous power to it, but you've got to do these things in collaboration and respectfully with the people who are going to be delivering the change.
Fantastic, thank you. Sonia?
So I guess it's kind of my role on the panel to say that I think without more resources, whether it's schools, hospitals, prisons, children's services, the whole host of other services out there, I just don't think we're going to see big improvements without more resource given the state of public services at the moment. So I think it's going to have to come from somewhere, whether it's as a result of growth or whether it's asking people to contribute more. I think the reality is I don't believe a Labour government would leave public services in the state they are, so it's going to have to happen somehow. I expect we may end up having to be asked to contribute more at some point because we're not spending enough.
Thank you. Harry?
I was very taken with your story about the book, James. I walked into a second-hand bookshop the other week, and there was a copy of Condition of Britain in there. For those of you who don't have long memories, it was a big piece of work that IPR did. And it was given away for free when we originally published it. It was for sale for £2. So it's either an indictment on the cost of living or a statement of our increasing value as a think tank. I wanted to pick up on the prevention point. I think there are some big technocratic changes in government that we can do to get that prevention spend, that invest to save, working. We've put out a proposal today to create a new category of spending. Demos have put a very similar proposal out to categorise prevention spend. I think on day one, I'd love Labour to stand up and say, we're going to commission a Nicholas Stern-type review to define what do we mean by prevention spend really rigorously in a way that the Treasury will buy into, and to say we're going to categorise spending in departments against that, and over time we're going to try and shift the balance so we're putting more into prevention because we keep talking about it and we never do it. So we need to take it seriously, and Labour needs to take it seriously from day one. But I would also emphasise that it also has to take the politics of that really seriously. There are not just technocratic fixes to these things. The second big problem with prevention spend is when it comes down to, in a local area, is there money going into a hospital or is it going to a GP surgery or in social care? And we need politicians to stand up and be brave and say, this is why we are making this change. This is why we're putting more money over here and not over here, even though we know that most people are going to say, I'd rather it go into the hospital. And on that, I do think the politics of this are going to be really difficult. When you're looking at reforms, it's very hard to have the following three things at the same time. A policy that's cheap, a policy that's popular, a policy that's quick and easy to deliver. You can get two of those. You can chuck some money at stuff and it's quick and it's popular, but it's not quick and easy to deliver. Getting all three at the same time is almost impossible. If it's there, it's already been done. And so given that Labour have said it has to be cheap, they're going to have to deal with the fact that it's either going to take longer or it's going to be unpopular, and they're going to have to manage the politics of that really well. So a kind of plea to think about, if we're going to shift money out into the community, if we're going to deal with prison sentences, short-term prison sentences and try and get more rehabilitation, all of these things that we know work, think about the politics. How is Labour going to sell it and talk about it?
Great. And finally, Steve.
Yeah, first I'd like to acknowledge the incredibly fantastic job that our public service workers do in extraordinarily difficult services. That they feel more acutely than any of us how the lack of resources and surging demand has made their jobs in many cases impossible, and yet they still continue to do outstanding work, and I think we should salute them for that. I fully recognise the issues about resourcing, and Rachel's on later, so you never know, and about the opportunities of digitisation as well, how that can be transformative. But from my experience, the thing that led to the biggest changes in public services, even when resources were going down, was involving people in taking decisions about the services that profoundly affected their lives. And for me, this is a question of power. Who has it? Who can exert it? Over whom? And power works much better when people are able to take part in the decisions about how it's going to affect their lives, rather than the state or public services deciding to take control over people's lives and take all the decisions for them. That deeply disempowering experience is very undermining, particularly of people who are already very, very vulnerable. So for me, different models of decision-making that open up power and include people in a very profound way about taking decisions about their lives leads to better services. It's much more respectful to the people who are involved. And at a time where money is in short supply, people are not. So we're daft if we don't harness their creativity and their insight into their own lives as we look at how we reform our public services.
Thank you. Sounds like we might have another P for our reports, Harry. So it just comes to me to say a huge thank you to all of you for questions, for listening and for attending today. A huge thank you to KPMG and to Read in Partnership, who've made our work on this programme possible. And a huge thanks to all of our speakers. And I hope you have a great conference.